Across Europe, the ambition to eliminate cancer has never been greater. With Europe's Beating Cancer Plan, we have a roadmap, but how do we ensure it translates into results? What we are seeing across many countries is that the actual challenges lie with implementation. In this context, OBS-PACE has been created as a project to help translate European policy into national action. At the core of the PACE project, we have a network of EU cancer experts from all across the Union, plus international organizations as well. They are all dedicated to the idea of learning from progress and sharing what interventions work in cancer control.
So the OBS-PACE is an EU-funded project focusing on learning from progress. It brings together networks of national experts from all member states, and it collected and analyzed cases on cancer care, research and policy from across these 27 member states. And by collecting this information, we know what works and what doesn't work across Europe, and we ensure that this information does not stay siloed within the limits of the countries, but that information and best practices can travel across countries.
Case studies are at the heart of the project. They are not a simple description of innovative cancer initiatives, but also identify health system blocks and enablers to implementation. So what makes an initiative work or fail on the ground? These aspects provide a practical how-to for other countries looking to scale or adapt similar initiatives so countries can learn from each other. It also adds to the European Commission understanding of countries' efforts in tackling cancer across the EU. It can form the foundation of more in-depth analysis, such as the policy brief on reducing cancer inequalities, a health system approach to implementing change, available on our website.
How the Commission, how DG SANTE is making use of this work and how it feeds into the broader work on Europe's Beating Cancer Plan. So for us it's quite important to see really progress on the ground. So we have these EU-level initiatives and we know of course what the EU-funded projects are doing, but there is in that way no systematic monitoring of any cancer policy in every member state. And to have this snapshot through the project, it's very valuable to see how the landscape is progressing. And also how this work is feeding into other projects, other initiatives like the Joint Action Orion, which was concluded in December already and had to focus more on national cancer control plans, but also on analyzing the impact of Europe's Beating Cancer Plan at the national level.
OBS-PACE provides a real-time update on cancer policy and impact. A European map, let's say, that gives the opportunity to gather information but also pinpoint relevant projects and interesting policies. From the standpoint of policymakers, this can be very useful as they can have access to well-presented and systematically gathered information, but also to the people behind it all, so that if someone wants to start something, won't start from scratch, and will have a helping hand when it comes to informing policies or shaping a comprehensive cancer policy. We believe that the OBS-PACE will be a starting point to inform our future policies in cancer and updating the existing ones.
A year from now, one of our goals is to have strengthened this network even further as a platform for gathering country insights, sharing experiences, and supporting cross-country learning. We are not only building a platform of information, but fostering a sustainable community of practice that can help enhance evidence policy and practice. Through this work, OBS-PACE aims to continue providing the insights and evidence health systems need to tackle cancer now and in the future.